Thank the member for Shortland. The question is the motion be agreed to. I call the member for Lyne.
Thank you, Mr Deputy Speaker, and I'm delighted to be able to speak in support of this motion, as we've seen real benefits associated with this initiative. As a medical specialist myself, having spent the last 20 years in the regions, I've seen the rural clinical schools and what they deliver. Now, the initiative was delivered by the federal government back in 1999, and the aim of it was to decentralise medical training, and now we have 17 rural clinical schools established by 16 of the 19 universities with medical faculties. Now, in our electorate, we have a campus of the University of New South Wales School of Rural Health in Port Macquarie, and in the Manning in Taree we have a Department of Rural Health. And they have both delivered great results. Now, there's a lot of evidence showing the benefit of this rural clinical school program. The likelihood of a doctor ending up in rural practice once they've finished their training doubles if they come from a rural background. Other factors that help is having a partner that went to high school in a rural location. But, ladies and gentlemen, there is another bit that will help, and that is rural postgraduate training. As a rural clinical school or any university only turns out a half-cooked doctor. You're graduated with a degree, but the gestation for producing a clinical clinician who can practice safely and competently takes at least another 4 years after that. Now, since 2003, we've had a massive increase in the number of medical undergraduates, from 1,266 to 3,185 graduating in 2015. But Australia has, in the cities, 370 doctors per 100,000 people, and in some of the inner city areas, even greater concentrations than that, versus 200 doctors per 100,000 in the rural and regional areas, and even less in the remote areas. But at graduation, most of the people leaving the rural clinical schools expressed a great desire to go into rural practice. In fact, at the University of Sydney Rural Clinical School, 80% said they wanted to have rural practice. At the University of New South Wales Clinical School, Rural Clinical School, that figure was 72%. So how do we convert this into a doctor who decides to live and work in a rural location? And the answer, ladies and gentlemen, is to keep this system going and then support it, because we've got half the recipe there. We just need the rest of it. And the remaining part of the recipe is to get postgraduate training expanded in these rural locations, because it's during this extended gestation of producing a skilled doctor that people set down their roots. They partner off, they get real estate purchases, they have children, they have social networks that develop, and all of this is lost if they are forced back into the cities to do their postgraduate training. Sure. Now, as the head of the Australian Medical Students Association said the other day, medical graduates can't fix a rural workforce shortage if there aren't rural training jobs to go to. Without an expanded rural training capacity, for new doctors would be forced to return to the cities, just how I was outlining. There, they would be likely to settle down. My case rests. Even the students have recognised that. Now, evidence that postgraduate training rurally delivers results is striking. Now, the Professor of the General Practice and Education Training Limited, his statistics indicate that if you've had a GP training in a rural location for half their time, there's a 46% chance that they will stay practising in a rural location for at least 5 years. That's a pretty good strike rate, 46%. A cricketer would be glad if he had a strike rate like that, let alone producing a doctor. Now, in my own little patch, where we turned the Port Macquarie Base Hospital into a postgraduate teaching centre from the humble Hastings District Hospital, it's now a base hospital, but it's an examination centre. We have a rural clinical school. We have 12 or more advanced trainees, trainee specialists, baby specialists. Now, from when we converted it to a training centre, resident in Port Macquarie, we now have 2 specialist cardiologists, 1 specialist chest physician, 1 specialist dermatologist, one specialist A&E physician and one infectious diseases specialist. That's not a bad strike rate out of medical registrars that we trained in Port Macquarie.
Order, the member's time is